How does an allergy blood test detect specific allergens? Have you ever wondered how a simple blood test can reveal what you are allergic to? Let's break it down in a way that is easy to understand. An allergy blood test works by measuring something called allergen-specific immunoglobulin E antibodies in your blood. These antibodies are produced by your immune system when it mistakenly thinks a harmless substance is a threat. This could be anything from pollen and dust to certain foods or animal dander. When you have an allergy, your body creates these immunoglobulin E antibodies, specifically targeting the allergen that causes your symptoms. To perform the test, a healthcare provider will take a small sample of your blood. This sample is then exposed to various suspected allergens in a laboratory setting. The lab measures how much of the immunoglobulin E is present that reacts to each allergen tested. If the test shows a high level of specific immunoglobulin E, it indicates that your immune system recognizes that allergen and may trigger allergic symptoms when you come into contact with it. There are two main types of allergy blood tests you should know about. The first is the total immunoglobulin E test, which measures the overall level of immunoglobulin E in your blood. However, it does not specify which allergens are involved. The second type is the specific immunoglobulin E test. This test measures immunoglobulin E antibodies against individual allergens. It helps identify exactly which substances are causing your allergic reactions. This specific test can screen for a wide range of allergens, including pollens, molds, various foods like nuts or shellfish, animal dander, dust mites, and even certain medications. This makes the specific immunoglobulin E test a useful tool for diagnosing allergies, especially when skin tests are not an option. Skin tests may not be possible due to skin conditions, medication interference, or personal preference. It is important to remember that just because the test shows the presence of specific immunoglobulin E does not mean you will definitely have symptoms when exposed to that allergen. Your healthcare provider will need to correlate the test results with your symptoms and medical history to confirm an allergy diagnosis. The results from the allergy blood test help healthcare providers create personalized management plans. These plans can guide you on how to avoid triggers and effectively treat allergic symptoms. So, the next time you think about getting an allergy blood test, remember that it is a valuable tool in understanding what your body reacts to and how to manage those reactions.